Good afternoon, Hattiesburg. Thanks for joining us for this COVID-19 City News Briefing for Wednesday, September 23rd. We'll start with test results as we always do. These are system-wide numbers for Forest General, Merit Health Wesley, Hattiesburg Clinic, Simrai, and the Moffitt Health Center at USM. As of this morning, 60,336 tests have been conducted. 6,599 of those have come back positive. 53,226 are negative. We have 510 tests currently pending. In the hospital today, between our two hospitals, there are 55 people who are COVID positive. That's just over one under the average for the last 2 weeks. We have another 10 who are under investigation. Of those 55, 15 are actually in the ICU. That's almost 2 under where we've been the last 14 days, and with another 1 under investigation. As we can see, since the peak in late July, we've continued to see a steady turn in people of that admission rate going down. We'll talk about that in just a second. In terms of, we did have 1 new death reported yesterday in Forest County. We do send our condolences to that family. Brings our total to date 71 in Forest County, 34 in Lamar. Statewide, 552 new cases were reported today with 24 new deaths. In Forest County and Lamar County, both had 16 new positive cases, combined 32 today for the metro area. Since the middle of March, 2426 total in Forest County, 1655 in Lamar County. Our 5-day average, this is where we take the number of new positive cases on a given day. We average it with the 2 days prior and the 2 days after. Of course, we did see the big spike on Saturday because of that data reconciliation that we believe that's what happened. However, now that we're kind of getting back down to single digits and low double digits, that 5-day average is going to continue to fall back down, hopefully where it was before Saturday. The inside 14-day number, this is where the number of people who received their positive test result in the last 2 weeks. In Forest County, that's at 183. In Lamar County, that's at 132. I will say that both of these numbers and the next couple of slides, again, were influenced by what happened on Saturday, even though those cases might have happened 2 or 3 weeks ago. But we continue to see that number fall. Compared to a week ago, 129 was the inside 14-day number. That number's at 183, 101 in Lamar County, 132 today. Hospitalizations, however, continue to tell that things are getting better. And 58 a week ago, 55 today, and ICU admissions fell from 19 to 16. So those are all positive signs, because our goals continue to be protecting the vulnerable, particularly as we go into flu season, preventing overrun of the healthcare system by slowing the spread, and then prioritizing public health by allowing the private sector to continue operating. We continue to lean on the widespread availability of testing, wearing of masks, watching our own data, listening to all voices. And speaking of listening to all voices, today, on Wednesday, we have our regular conference call with all of our public schools, our universities, our government emergency officials, as well as our healthcare providers. And there's a couple of conclusions that we kind of walked away from today. First of all, new admissions in our hospital per day is down. And I'll tell you that at Forest General, for example, back in July when we were hitting that peak and we got up to over 100 in the hospital, there were 13.6 new patients that were COVID positive per day. In August, that number fell to 9.3, and now we're about half of that. We're at 6.2 for September, which shows that we're heading in the right direction. The second thing is positivity rate is steady. We've actually dropped it down to below 6% now, and actually fewer people are going in to get tests, which is a positive sign as well. We hope that continues. K through 12 spread is very limited, and we've had a handful of cases both among students and faculty, but for the most part, our faculty and staff and parents and students are doing a great job following the protocols that each school district has laid out. And I really want to express my gratitude. We heard from both of our private schools today, PCS and Sacred Heart, as well as Hattiesburg Public Schools, but I know Petal, and I know Lamar County and Forest County have all done a really good job of doing the best they can with what could be seemingly a chaotic situation with hundreds of students running around. But the fact that we've had as few infections as we've had, and that we're doing a good job of parents are speaking up when they've had a household contact, and people are doing a really good job of keeping themselves isolated if they have been exposed, shows that everyone's coming together to do the right thing here. And finally, contact tracing is working at universities. We know the Southern Miss has an app where students who are positive can go back and trace their contacts. This has allowed them to find those asymptomatic people who test positive, who could be super spreaders. And even though we have around 50 active cases at Southern Miss right now. The university is doing a really good job of getting them into the health center and getting them identified so they can isolate themselves and not spread it even further. So really just can't say enough good things about the job that both our universities and community college and K-12 schools are doing throughout this pandemic to slow the spread. Speaking of Southern Miss, they today launched a free online public course that you can join that assists in understanding all the issues that surround COVID-19, whether that's how the disease spreads or whether maybe the byproducts and the dangers of mental health that come from this pandemic and warning signs that are out there that you can spot and help people. Or maybe just the groundbreaking research and the work that Southern Miss is doing. I realize in a time of social media when everyone, it seems, thinks they have a degree from the Facebook School of Public Health, getting actual good information is hard to come by. And so kudos to Southern Miss for putting all of these resources and professionals and experts in one place. So if you'd like more information on accessing this free public course, go to usm.edu/COVID-19. We have just 8 days left in the 2020 census. Our response rate, thankfully, moved up to 56.5%. Now is the time to figure out if there's anyone in your organization or your business who hasn't filled this out. Now is the time to check with people on your block or your apartment complex to see if they filled it out. If you want flyers to distribute to your neighbors, we'll be glad to provide those to you. This is an all-hands-on-deck approach because so much is at stake with this census count. So HattiesburgCounts.com is the place that you can send people to fill out their census form. And some city news. Paving continues in our city. Crews over the past 2 or 3 days have been in the Audubon-Kirkwood neighborhood, taking care of that area just south of Lincoln, as well as one street off of South 34th Avenue in the Jamestown-Lincoln Neighborhood Association. So progress continues. Thankfully, the weather has held off for a couple of days, and we've been able to get some work done. And finally, our active coverage. Last weekend on CBS Saturday Morning, there was a piece run about our own library of Hattiesburg, Petal and Forest County. It told the story of a local resident who in 1964 was denied a library card at our own public library on account of her race. That impression was a very painful experience that never really left, but inspired a lot of positive life choices that affected a lot of good people. I won't tell you the whole story. I encourage you, however, to go to the Facebook page for our library, the Library of Hattiesburg, Petal and Forest County, and we're actually going to post that link with this video, and watch what real leadership and compassion in action will do. However, all I will say is that we are lucky to have our library and its director, Sean Farrell, and we thank him for his thoughtfulness in this gesture, and we thank this resident who overcame, and we thank her for her courage and those who were with her those many years ago. And as we continue into this week, remember to wash your hands, take care of yourself, wear a mask if you go out in public, do only what is essential. Remember, you're safer at home. Have a great rest of the evening.